Hello everyone, welcome back to my channel Dr. Medico. In this video I'll be talking about the schizophrenia, which literally means a splitting of mind, but it is basically not the splitting of mind, it is a syndrome. Schizophrenia literally means fragmenting of mind, but it is one of the most complex, chronic and challenging of the psychiatric disorders that affects how a person thinks, feels and behaves. So in this video we will be talking about schizophrenia, which is very important in its prevalence is more in male than female. So in this video we will be discussing about the etiology, epidemiology, sign and symptoms, types, complication, diagnosis, prognosis and management. Before starting the video, I would suggest to you to watch my channel on bipolar disorder. Watch my video on this topic in the channel Dr. Ayurveda Medico. So etiology, genetic predisposition, environmental, social and physiological factors lead to neurodevelopmental abnormalities and target features, ultimately leading to brain dysfunction and improper balance, which is schizophrenia. So epidemiology, if we talk about the peakage of onset, then it is 26 to 32 years in females and 20 to 38 in males. Men has more prone to this than women. We will read about the types: positive, negative and cognitive. So first of all, starting with the paranoid schizophrenia, this is a common form of schizophrenia, which is having prominent hallucination and delusions. Speech and emotions may be unaffected, but the risk for suicide and violent behavior. So this paranoid schizophrenia is more common form of schizophrenia. Rest all, that is hebephrenic, disorganized schizophrenia or catatonic schizophrenia, undifferentiated schizophrenia and residual schizophrenia are less common than this paranoid. If we talk about catatonic, then what is it? It refers where the condition of malnutrition is there in patient, unable to talk and such conditions. Now if we talk about the positive symptoms, then delusions, hallucination, disorganized speech and thinking and catatonia is present. Cognitive symptoms: poor executive functioning, poor working memory. Negative symptoms, which include the flat effect, alogia, evolution, asociality and reluctance to perform everyday tasks. Now if we talk about the dopamine tract, so when dopamine hypothesis is there in the pathophysiology of schizophrenia, that if we do the numerous positron emission tomography test, studies have shown that dopaminergic hyperactivity in the nucleus accumbens and dopaminergic hyperfunction in the frontotemporal region. These are the dysfunction in the test which are shown. So this is the dopamine origin and insertion, which I am showing you here, its pathway. So nigrostriated has its origin in substantia nigra. Mesoclambing has origin in ventral tegmentum. Mesocortical dopamine tract, which has origin in ventral tegmentum same, and dopamine tract of tuber hypophyseal is hypothalamus origin and pituitary gland insertion. So this is the very important function of dopamine: movement, arousal, stimulus. Now if we talk about the complications, then depression, anxiety, which may be social anxiety, OCD or panic disorders, suicide or substance abuse and smoking, violence, self-injury. These are all the complications which can be noticed in the patient of schizophrenia. So if we talk about the diagnosis is the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, medical histories, CBC, MRI, CT scan and psychiatric evaluations, like if the patient is having delusion or not, hallucination or not, disorganized behavior, catatonic behavior, impaired functions, impaired behavior. Management includes the hospitalization and psychological interventions, which include the individual therapy, social skills training, family therapy, vocational rehabilitation and supported employment if the reason is unemployment. Then electroconvulsions therapy, ECT, cognitive behavioral therapy, CBT, and APA guidelines suggested 3 phases for the treatment or for the management of schizophrenia, which is acute phase, which is limited to 4 to 8 weeks, stabilization phase, which goes till 3 months. And if you talk about the medications, then antipsychotics, neuroleptic, and tranquilizers are suggested for first generation antipsychotics like phenazines and butyrofenones. Clozapine is one of the effective in decreasing suicidal behavior tendency in schizophrenia patients. Risperidone is also second generation, and olanzapine. These are the important medications in the treatment of schizophrenia. So yeah, thank you for watching my video, and please do subscribe for more such